It is just a huge honor for me today to be podcast interviewing two legends who happen to live right in our backyard, Phoenix, Arizona. I don't even know if I should read all your bios. Brian Harris, general dentist. Stephen Frost. Both of these guys need no introduction. I will start with Brian because, funny story about Brian, his dad is a legend. And his dad, Joe, is 10 years older than me. And way back in the day, when I had 4 boys in 60 months, I was going to LVI to go out Dickerson, and when I was going to CE classes, everybody would talk about his father, Joe, who's a legend. He's just an amazing man. And we were at LVI, and I had the guts to walk up to him and say, hey, when we go to Vegas, do you care if I share a room with you? And he thought at first it cost. He goes, you mean to save money? And I go, no. I said, I don't care about veneers, bleaching, and bonding at LVI and Dickerson half as much as you've raised 4 boys, and your boys are 10 years older than mine, and I got 4 boys. And at nighttime, I don't want to talk bleaching, bonding, veneers. I want your advice on how to raise boys. And he said, oh, that's cool. So every night after LVI, we'd go back in. The hotel room had 2 beds, and we both just laid on our backs, no TV on, and we just talked family values, raising boys, everything. And I'm not going to say which of your 4 brothers was the troublemaker or what he said about you. But it was just amazing. And then Steve, he had 4 boys, and then he had to rub it in that his 5th one was a girl. And I tried to have a 5th one, but that never worked out. But anyway, so man, there's so much to talk about today. I don't even know where to begin. So you want me to read your guys' bio? So Brian attended Arizona State University, graduated University Pacific School of Dentistry, 2007 Hornbrick Group Scholarship for being named Young Dentist of the Year, International Lecturer, CERAC Trainer, 2007 to 14, 8 years running, Phoenix Magazine, Top General and Cosmetic Dentist, 2014 Arizona Foothills Best Cosmetic Dentist in Scottsdale, Arizona. There's so much. You're a key opinion leader for Kerr. You're a CERAC trainer. Your work is, it's impeccable. I mean, when I see your cases, how long have you been a dentist?
12 years now.
Yeah. I have, on my wrist, I have feet attached. And because you could go to 8 years. We could all go to school 8 years to become a painter, and there could be some little 12-year-old girl over there that never went to school as the master painter.
Phenom.
And I'm and I feel like I went to school for 8 years to learn how to paint. I'm not a painter, and I feel like you were born a painter and just happened to become a dentist because you are an amazing artist. And then you're an endodontist, and I still think it's funny when I ask dentists what their worst procedure, what procedure do they hate the most? It's always molar endo. It's never a filling, it's never a crown, it's never an extraction. And so how does it feel to have a job that almost all my homies would rather just get ran over by a car than be an endodontist?
The interesting thing about it is I have a twin brother, and we're identical. And in dental school, he perfed his first over-the-counter, case that extracted tooth, and so he said, "Hey, this is not for me. I'm doing orthodontics." So he was probably the smarter one of the twins. It feels great. I love the challenge of working with the emergency dental patient, and it's been awesome. 22 years.
Well, first, speaking of your brother, you got to share the story because I was just casually reading the newspaper and I read a story about you and your orthodontist twin brother that made me cry. Tell them the story. That was an amazing story.
So we're in Newport Beach for California for a family reunion, and we go to the beach one day. It's July 2nd, and we're just having a great time at the beach, perfect weather, and we see this mother walk up to the lifeguard tower, and we can kind of hear her, frantic cries for help to the lifeguard, and she's like, "I've lost my son." And I think we've all kind of felt that feeling before of a lost child, and what that does to you. It just kind of sends chills through your body. So we just decide that our mom taught us a long time ago that we pitch in and help in that type of situation. So we gathered the family and we walked down to where she has walked back to the spot where she lost him. So we think it's about 4 minutes has transpired where she can't find her son. So when we get to her, she's standing at the top of the sand and she's got this look on her face like, "I can't find my son." So we just said, "Hey, where was he last? What happened?" And she said, "He was right here digging, and I turned to put sunscreen on my daughters, and I turn back and he's missing. And we're like, wow. So for some reason, maybe it was inspiration, maybe it was just that we had heard 2 years ago a lifeguard talk about not digging sand tunnels, but it dawned on us that this little boy could actually be under the sand. So my nephew and my twin brother Stuart start digging in the sand, and I check the water to see if this boy, his name is Brooks, cutest little boy. So they start digging, and my nephew Jesse sees him about 2 feet underneath the sand. Just made us sick that this poor little boy had been buried alive. He had actually been buried face first. The sand had collapsed on top of him. My nephew pulled him out by the pants. And when he said, "I've got him," I ran back to the sand where he actually laid him down. Sorry if I get a little emotional. But as they pulled him out of the sand, this poor guy was gray. He was dead. He hadn't been breathing for quite some time. So my twin brother Stuart cradled his head, cleared the sand out of the mouth, and instinctually, which is amazing, that all of the classes of CPR certification, everything came back immediately without even thinking about it. So I started the chest compressions. Stuart has his head clearing the sand out, and within a couple minutes of a pretty aggressive CPR, this little boy's tongue moved, and Stuart said to me, "Did you see that?" His tongue moved, and I thought, well, maybe it's because I'm really pressing hard, because I wanted to save that little boy. His mother was right beside us, and she just was a chocolate mess. Just I can't even imagine the feelings that she felt seeing her son lifeless. But so I'm doing chest compressions, and then all of a sudden I see his lip quiver. Stuart turned to me, and this whole time it was just amazing, because when instincts kick in and everything around you is quiet, and it's just the twin thing kicks in. It's just my twin brother and I, which we have that special bond where you're just actually just in that moment. And he says to me, "You actually think this boy's going to make it?" And I said, "I think he's coming back." And so we're just keeping going with the CPR. Next thing we know, he moves. It's like the spirit comes back into his body. His whole body lifts up. And at that point, I turned and I looked around, and we had probably 50 to 100 people surrounding us. And I said, "Hey, is 911? Did anybody call 911?" Which actually was the only mistake we made, but we probably should have said, "Hey, somebody call 911, start the CPR." But somebody already had done that. And within a few minutes, the lifeguard and also ambulances showed up and administered 2 breaths with a mask, and the boy came back screaming alive. It was the most exhilarating, the most scary situation that I've ever been in my life. So shout out to all the people who take dental training for CPR. I'm telling you guys, it is absolutely worth it, because when you're in that moment and the instincts kick in, training is everything.
Now, did you keep his name or contact or address?
Yeah, it was the craziest thing.
Are you going to send him a Christmas present this year?
Yeah. I said to his mom, I said, I want to keep in touch with Brooks the rest of my life, because you know what? It's truly a miracle. Brooks' existence on this earth is going to be something special. He's got a job to do in this life, and I can't wait to watch it unfold.
That is so cool. How old was he?
2.5.
Oh my God.
Yeah.
I'll tell you, when Grandpa dies and you go to a funeral, everybody's like, "Oh, you had a good life." When Grandma dies, there's tears. But God, when a baby dies, the house just falls apart. And those mothers, 10, 20 years, 30 years later, they're still broken.
Broken.
We know a lady, and when we go to her house, she's 70.
Yeah.
She's 70. She sells a shrine of her 6-year-old son who was killed in a car wreck.
Wow.
Candles, shrine. I mean, it never goes away.
No.
So that is so cool.
Thanks. Appreciate it.
So how did you guys meet?
So I'd been referring to Steve for my endo for years, because I hate doing endo, like you said. But the crazy thing is, his office is literally, there's 50 endodontists between my office and his, and he's 30 minutes away. I practice in Phoenix, he's in Mesa. But the way he treats patients is very similar to how we do in our office. So it's all about true, excellent patient care and communication and good follow-up. And so we started working together that way. I've been referring to him for years and years, and that's kind of where our relationship started.
And And now you guys, what did you guys want to talk about today? Because you've started something very, very interesting. I mean, I wanted to, I could lecture. I could podcast you on just endo.
Sure.
And if you ever want to come back and just do an endo
I'd love to.
podcast, I could lecture. I'd like to podcast you on come back on CERAC training.
Sure.
I mean, you're a key opinion leader for Kerr. But the thing that you're doing today that I think's really amazing is on-call dental urgent care. Did you guys want to talk about that today?
Yeah,
Mostly?
let's do it. I think that's.
But you got to come back and talk
I'll come back
CERAC.
and talk CERAC.
And you got to come back and talk endo. And your brother's got to come talk ortho.
Yeah, we will.
But he won't talk to me because I'm a general dentist.
Yeah, no, he will.
He'll only talk to other orthodontists.
No, he's real. He's cool.
So what I was so excited about is I had what I see what you're doing. I wanted to do 29 years ago, but I had a moral quandary. I saw, you have a hygiene room, and the insurance company only give you $60 for a cleaning, and then I have a room over here, and they would give me $800 for a root canal, or $1,000 to pull 4 wisdom teeth, and there was just no money in hygiene. And I thought to myself, when you look at just the profitability, I just wanted to have an emergency dental center. And I thought, I'm in Phoenix, I'm kind of in the middle of town. I'll just start an emergency dental care. But my moral quandary was I had 4 kids, and my religion was like, treat other people like you want to be treated. And I didn't want my kids to live in a city where they just sat there and waited till you needed a root canal and a crown.
Right.
So I said, well, I have to have a family practice with all these high overhead hygienists that barely break even, because that's what I wanted for my 4 boys. But if anyone ever doubts that the sweet spot of profitability is in endo, oral surgery, emergencies. The other thing is dentists aren't very good in sales. You've always been able to sell cosmetic dentist. And I want to say something, if you're thinking about being a cosmetic dentist. Whenever I've met a cosmetic dentist, whether it be Larry Rosenthal, Bill, Dorfman, you, Phoenix, look at his hair. They're always gorgeous. They could always be a GQ model. Short, fat, bald guys don't sell cosmetic shit. If you go to the most rocking hot breast doctor, facelift doctor, they're always a GQ guy. So if you look like me, be an endodontist or, a family practice, because it's true. Because when you're hot, you make all these people do all these cases. But the point being is that most of my homies are shy introverts. Most people became a dentist because they didn't have enough personality to become an engineer. And the engineers are the ones that didn't have enough personality to become an accountant. And the accountants are the ones that didn't have enough personality to become a programmer. You don't have to sell a toothache. I mean, you have to sell veneers, bleaching, bondings, and rehabs. You don't have to sell, God dang, this thing's killing me.
Yep.
I want to take care of it. And also, they're not shopping price. You're usually committed to doing the root canal or extraction, and they haven't even seen the price or the FA, or they don't even know what they're going to have to put on their Visa card.
They just want to get out of pain.
So walk through the model. So you started OnCallDental.com 2 years ago today. Tell us how this. What was the genesis of this?
So the way it all happened, I mean, I had the same issue you did. I mean, I've been more of a fee-for-service practice, 12 years. I mean, we've always done the dentistry the way that we were taught to do it 10, 15 years ago. And so it was, I'd spent 10 days in Dominican Republic. I took my wife and 2 kids there. We were doing dentistry, small villages, and I got...
Is this with your oldest brother, Eric?
No, this is, Eric wasn't there at the time. Eric runs a program now where he does stuff there.
So his father, Joe, had 4 sons. 3 are dentists, 1's a lab tech. His older brother teaches at the dental school, Eric,
Yep.
and I climbed Mount Kilimanjaro with.
Yep.
And I credit him for getting my fat ass up to the top, because the last 2,000 feet I was done.
Yep.
And your brother screamed and yelled at me for 4 hours. Keep going, keep going. I love Eric so much. So then continue.
So I came back. I got pneumonia coming home. I'd just been gone 10 days doing dentistry in small villages. My schedule was packed on Monday. So it's Saturday evening, and I thought, I got to get this fixed now. And my wife said, hey, just go down the street to the medical urgent care. And I'd seen them on every corner. I'd just never been to one. And so it was 15 minutes later. I was in and out. The doctor was wonderful. I got scripts for antibiotics, and by Monday morning I was better. So it stuck with me for the next week, and it just kept coming back to me like, we as a profession, are not everybody, but most of us are used to the 7 to 4, Monday to Thursday, when we know, we're one of the last businesses on the planet that operate that way. I mean, most other businesses are open when you need them. And so the idea came to me of like, why isn't there anything like this in dentistry? So Steve, naturally, he's an endodontist and a good friend of mine. So I was at the gym one morning and I called him and I just said, Steve, hear me out for a minute. I was at the urgent care. I saw this. Why don't we have something like this in dentistry? And it got kind of quiet on the other end. And he's like, I think his exact words were, dude, you just gave me the goosebumps. And he's like, meet me for breakfast. So we met for breakfast and he rolled out. He had a notebook that was from 8 years previous of a whole business plan of how to open a dental urgent care with logos. And we both kind of knew, hey, this is meant to be. Within 2 months, we had bought our first location, and 3 months after that, we started building our second one. I mean, we kind of did a ready.
Okay, now, walk me through, because you work with your dad Joe, and your brother, you're Brian, and then your brother Scott.
Correct.
So you guys have 3 offices in Mesa, Scottsdale,
And Phoenix.
Phoenix. So you said so these are 2 different locations,
2 separate locations.
and they're a dental urgent care.
Yep. So one of them's open 7 days a week, and one of them is open 5 days a week, and the whole focus is.
And where are these located?
These are Tempe, Arizona, and Glendale, Arizona.
And which one's 7 days and which one's 5 days?
Tempe is 7 days a week.
And why is Glendale 5? Just staffing?
Yeah, you know what? Once we got going, we were 7 days a week, and we had an issue with a doctor that needed to find work elsewhere, and so we went down to 5, and then we started looking at the numbers, and we thought, hey, we're just as profitable at 5 as we were at 7, and so we kind of left it there on purpose, knowing that now we were in the mode of kind of proving the model.
And if you have a toothache, you drive from Glendale to Tempe, wouldn't you?
Absolutely.
Yeah.
People
It's in so much of this culture, like there's 1 million physicians and there's 200,000 dentists. And physicians will graduate from school and they'll go get a residency and they'll say, you're going to work a 24-hour shift on Monday and a 24-hour shift on Thursday. And they say, okay. You ask a dental graduate from AT Still to stay up until 7 and he thinks you're from Mars.
That's right.
And what's in a lot of it's cultural. Like look at the difference in the Italians with pizza, Chinese, Mexican food. I can get any Italian pizzeria or Chinese restaurant delivered to this house, and you call a Mexican restaurant, and they're like deer in a headlight. They're like, deliver.
That's true.
Is the Mexicans can't deliver? Why? Because they're culture. They're the hardest working people I know, but they don't deliver. But every Chinese restaurant. So you go to the dentistry. And you'd be luckier to have a heart attack on Sunday than a toothache. And then you go to the emergency rooms, and the emergency rooms in this state of Arizona say 8% of the ER visits are tooth related, and these dentists are working 32 hours a week. So the void in this market is crazy, and it's the most profitable section. Yeah. I don't want to do a recall visit and a prophy and no bite wings. I want a root canal.
Well, we're at 95% case acceptance rate because
it's emergency.
Well, they come to us with an issue. They know. I mean, who's going to drive all the way across town knowing they need something fixed and not being able to pay for it? I mean, they expect to pay for it.
And back to you saving a life.
Yeah.
Just Google people dying from dental abscess. I mean, the Centers for Disease Control.
Yeah.
I mean, people die every year. More people die from dental decay every year than get hit by lightning.
Just tell me about the CEO from the
hospital.
hospital.
I had a patient in the other day. She's CEO of one of the hospitals here in town, and she came in for a consult, and she was like, hey, I'm traveling tomorrow. And I didn't know she was the CEO of a local hospital, and she said, I've got this toothache, and I need to be seen. And so I just made it happen. I switched a few things around and saw her during my lunch hour. And she came back in for a follow-up 2 weeks later after her little business travel, and I said, hey, how did your business travel go? And she said, oh, it was really good. I lectured to 1,000 cardiovascular surgeons in Seattle. And I said, what do you do for a living? And she said, oh, I'm the CEO of this particular hospital. And she goes, by the way, she said, I want to tell you, she said, we would have the absolute most profitable hospital in the world if we could do what you did for me. And I said, what was that? And she said, you solved a problem for me like instantly by fitting me in. She says, we can't get our physicians to do that. And so it's interesting. So what happened with this whole relationship with Brian and I is that on Monday mornings, I was seeing these patients come in from the weekend, and they'd been to the ER. And they come into my office as an endodontist, and they're swollen, and they've been in the ER for maybe a day or two. And what they're getting from the ER is a prescription for an antibiotic and a pain pill. So Brian and I, when we set up this on-call dental urgent care system, our whole tagline is we do it differently. We're going to provide treatment for these patients and a solution for, other than going to the ERs or the emergency departments. It's a $2.1 billion industry where, in a bad way, where patients are being seen and clogging up the emergency rooms and the urgent cares.
They lose that much every year.
They're losing that much every year, $2.1 billion.
Hospitals.
And how are they? How's it a loss? Because they're coming in and
because it costs it costs like $1,300 to $1,800 for them to triage a dental emergency patient, because they still have to triage them the same way that they would
Right.
a broken arm, and so the amount of time eating up the room, paying the doctor,
and they have to triage you if you have no proof of payment.
Yep.
That's exactly right.
And then what do? They write a script for a pain med and an antibiotic.
We
So
really can't do anything.
Panvic and Vike, that cures
So if
every
you talk
endo
to-
infection in every hospital.
any hospital, they'll tell you, hey, it's a problem they talk about, and there's tons of research out there. They're trying to solve it because it loses them money, and it's why all the big ones now here in town are opening up their own medical urgent cares, because it's at the
And I think you would, yeah. So the website is oncalldental.com. What are my homies gonna find if they go to oncalldental.com?
So the concept started with the 2 locations here, and we realized that this has legs. I mean, if it's an issue here in Phoenix, Arizona, it's an issue in every market. And so the concept is that we're licensing the model similar to like CrossFit does. CrossFit model it's a strong brand where they coach you on how to open an urgent care, or they don't coach you in urgent care. They coach you on how to open your own CrossFit gym, and then they provide the services, they provide the marketing. So that's kind of the model, is we're going to teach these doctors how to put a dental urgent care location in their own office nights and weekends, leverage the space. It's already sitting empty 3-4 days a week. They've already paid for the equipment. Basically create a practice within a practice.
So what you're talking about is there's 2 types of costs. There's fixed costs, which are costs that don't go up or down with the amount of your activity. You pay your rent whether you're closed or see 10 patients or 100. So your rent, mortgage, equipment, bill, computer, insurance, all fixed costs. Your variable cost, which is your people time, your people supply and lab bill. So the dentist is on average makes 35%, the staff's 28%, so 53 cents of a dollar goes to people, 10% labs, 6% supplies, but they're only open 19% of the week.
Yeah.
So 81% of the 168 hours in a week, they're closed.
That's right.
So your model is to go find one of my homies and say, you're only using this thing 19% of the week. You've already paid all your fixed costs. Let's start seeing some lucrative emergency patients that you don't have to sell them dentistry. They're begging for you to do it. And the high-end procedures, like you go to a hospital, they lose money in triage, but then they charge $100,000 for a bypass.
That's right.
So it's the bypasses and the surgeries that are
They're
paying
making money.
for everything.
We're basically the Uber and the Airbnb of dentistry.
So how's this business model work? What's the cost for the licensing model?
We thought, we spent about 6 months trying to figure out, is it a franchise model? Is this something, because we're getting 150 to 200 new patients a month per location. So when you compare it to some of the other internet lead companies out there, I mean, you could charge a lot for what we're doing, but if we're going to really make a movement, if we're going to really help doctors all over grow, the licensing model makes the most sense, because the doctor pays a monthly fee. Howard, $99 a month is the licensing fee to use the branding, to be on the website. I mean, super inexpensive.
$99 a
Yeah.
month?
Yeah.
So the certification fee is going to be, there's 2 types of certification, but they can get certified online, kind of fast track program. It's just under $1,000 to do that. Or we do the live courses here in Phoenix, just under $2,000 to do that, where they get certified to be a provider. Then they're paying a monthly fee to have access to the branding and some online coaching and education. Then after that, they can pay additional SEO features. They can pay for consultants to come in and help coach them on really how to do it. But the idea is that the doctors that implement this, they get to keep all the revenue. You know, that we don't take a percentage like a franchise would, that we're really trying to help these guys.
So at $99 a month, are you going to make any money on this?
We will. We make our money. Truthfully, we make our money on the certification part up front, and then we have a starter kit that's just under $1,000 a month that gives them all the tools they need, and we make our money on the community we create, and you know, eventually off of some of the consulting stuff, but. We're trying to break down as many.
You have an on-call vet that'll show up at your house and shoot your cat.
That's next. You know, I think the thing that's fascinating to me about this whole process is Brian and I were coached pretty well at the beginning, and so what we did is the analytics of what we were seeing walk through our door is fascinating. So we can track who these patients are, and so. When we look at these numbers, we're seeing what we call the 38%. 38% of the population that's not seeing a dentist.
Right.
And so that 38%, they haven't seen a dentist in 5 years. So we really believe that what we've seen and what we're actually doing is we're growing dentistry.
But are these people less likely to have insurance? The people not going to the dentist are usually the ones not having insurance.
No, our analytics show that 50% of these patients that come in are your doctors, your lawyers, your
too busy.
People, yeah, it's where dentistry doesn't. And me as a dentist, where my schedule doesn't fit their schedule.
Yeah, the Affordable Health Care Act. When the Federal Reserve chimed in on that, their data was amazing. They're the number one employer of economists around the world. They have 3,000 PhD economists, and they were saying that America had 324 million people. 140 million of them had a job, and of those 140 million, it was something like I don't know the number off the top of my head, but it was over 50 million cannot leave Monday through Friday 8 to 5 from their small business to go access healthcare. So they're talking about accessibility, not just affordability. And they're saying the problem, and in rural, the problem is like in a dental office. I mean, you can't have your receptionist say, at 10 o'clock, I'm leaving, I'm going to I'm going to have a physical. What do you mean you're having a physical?
Yeah.
It's freaking 10 o'clock on a Monday. You're not having a physical on 10 o'clock on a Monday unless you're bleeding in 3 places and have pneumonia. Yeah. You're going to stay at your desk. Well, that's 50 million people.
That's right.
So if you're not open before 8, if you're not open after 5, if you're not open weekends, you just crowded out a lot of Americans who don't have access to your hours, even though they have money to pay, physician, attorney.
That's exactly right.
So these emergency patients, what is the breakdown? Extraction, root canal?
Of the people we're seeing, 50% cash pay, 50% insurance. And so it's a pretty even split. And as far as the procedures done, we thought it was going to be mostly oral surgery and endo. Okay, and it started that. We do quite a bit of extractions, surgical extractions. We do bone grafts on about 30% of all those. So, you know, it's not like these people are coming in just choosing the cheapest way to get treatment. You know, they do want the right care. But just a couple months ago, our highest procedure code, you know, as we run the codes, was restorative. So a lot of these patients are saying, hey, you know, one, we gain their trust because we're there for them. We treat what matters most to them. So now they're asking, hey, well, can we come back? Can we do our other dentistry? And so we're still doing a lot of fillings, a lot of crown and bridge. So what we're trying to create is a situation where we help the dentist understand that, hey, this is a funnel. This is a funnel to capture a percent, that 38% of the population. We're becoming masters of the 38%. Nobody else is going after them. And so we're going to teach dentists how to capture that and then how to convert them into patients for life. You know, it's a process.
A lot of dentists complain about no-shows and cancellations. And a lot of no-shows and cancellations because the consumer calls up and says, I'm having an emergency because they broke their tooth. And then the receptionist says, well, that's not an emergency. Emergencies keeping you up at night, swollen, pain, taking aspirin, Tylenol. So I can see you next Friday. Well, then they get on their smartphone, Google Phoenix Dentist, and then the person doesn't come in Friday and they say, I can't believe it, that lady just made that appointment 3 days ago.
That's right.
Because you sold her something she didn't ask for.
Yeah.
That's right.
She asked to come in today. A dentist's definition of an emergency isn't the consumer's definition.
That's exactly
If
right.
you're brushing your teeth and you feel a hole and you're scared, you didn't know you had a hole there, and you want a doctor to look at it, that's an emergency. And my gosh, every time I've gone to the emergency rooms, so many times raising 4 boys, and I'm sure you have. And I mean, the definition of an emergency at an emergency room hospital is from A to Z.
Yep.
I mean, it's all over the board.
One of the things that we realized was that we're dealing with this new breed of patient, this 38%. They're not like your typical dental patient. So, for example, my daughter, who's 13, she drops her iPhone. 9:30 at night, cracks the screen, and you know what she says to me? Well, let's go get it fixed right now. That's what we're dealing with. So these 38% of the population, you know what? We've spent 2.5 years really figuring out how to treat them. So sometimes when they come into the office on a weekend, and let's say we've got a waiting room full of people and they've got a toothache, well, we're not doing a full root canal on them. We're doing what we call the on-call experience or the on-call win. And so we're bringing them into the office, and you know they've got trepidation. They're worried about feeling pain. They don't trust the dentist. But this procedure that we do, we call it the 10-minute or the 15-minute triage, where we can do a pulpotomy in 15 minutes, gain their trust, like Brian was talking about. You know what? It's really starting to resonate with people.
My job is the Dentistry Uncensored. You guys have attracted 2 of the 3 cats. Let's see if you get the baby to come up there. And I'm like, who are these people in our table?
Like fighting for
okay, so
screen time.
let me tell you let me shoot holes in your business area. A lot of my homies probably listen to this saying, I don't like emergencies. They just want Vicodin. They're just wasting my time looking for Vicodin. What would you say to that, dentist?
I think they're wrong. I think that the emergency is exactly what you said. The emergency patient is completely different than what we think it is. It's somebody who has cold sensitivity that doesn't want cold sensitivity anymore, and they realize that they got to take off, you know, a Monday or Tuesday, Wednesday, Thursday, or Friday to get to see the dentist, and they don't have that luxury. And so it's cold sensitivity. It's a chipped tooth. You know, it's not just your typical person that comes in that's just really swollen, that's infected, that's very difficult to manage.
Well,
And that's really the total cost, because a lot of times in your walnut brain, you're telling someone, well, you need to come in and get this crown, and it's $800. And this guy's a plumber or a welder, and he's saying, I'd lose $1,500 coming in getting that $800 crown. The crown is the cheapest part of the cost.
Right.
Losing an afternoon of welding on a rig,
Yep.
you know, so the total cost, if you're,
That's a great point.
you know, it's one thing. So what is it? You know, you either work for 1,000 or more employees. You either work from the mid-level, 50 to 1,000, or 50 and under. All those people, 50 and under, can't leave their business. The only people that can leave are people working 1,000 or bigger. You can leave Intel.
Sure.
They've got enough scales of economy that if any given percent of their people got to leave, it's cool. 50 to 1,000 is tricky.
Oh yeah,
50 and under, it ain't happening.
right.
Well, and that's going back to your question. It's if it's people looking for pain meds and we write a script, how are we any different than regular urgent cares of the hospitals? You know, we're not solving the issue. So that's another way that we avoid that is, you know, I'm happy to write scripts for people when we do treatment, because we're there to fulfill that need and to do the treatment. And we're there to give them an answer to the problem, not just a Band-Aid. And so that was one of the biggest concerns when we started, and it hasn't been an issue, truthfully.
Well, I'm going to be selfish on this podcast. My today's dental monthly management meeting is tomorrow at lunchtime, 1 to 2. Any chance you guys could be free 1 to 2 tomorrow to pitch my team?
Tomorrow.
If not, we can set up. Well, we can set up a different time. But
tomorrow
I'm available.
I can be there. We can be there.
Yeah.
you know where Dental Town is?
Yeah, I'm around.
Tell them your Dental Town roots. Back when it was in 1,000 square foot rental.
My Dental Town roots. I've always been following Dental Town for years and years. But in 2005, I first graduated from school, and I called you up out of the blue and just said, "Hey, I've got an idea." And you know, the one thing that amazed me about you is, as successful as you've always been, you listen and you'll do whatever it takes to help people around you. And so I had that idea for that CE calendar to list of all the CE courses in the nation, and you not only helped give me advice, but you came and brought it into Dental Town, and we ran with that for 5-6 years, and then you know things got busy for me, and you guys improved it a little bit, and so now you're doing that on your own. But that's always, I've never forgotten that.
How many kids did you end up having?
I have 4.
Oh my God, you're as crazy as I am. He's the craziest one, but he's the luckiest one. You got a girl. What was your split?
2 boys and 2 girls.
You got 2 of each? Yeah, Ryan, you were supposed to be a girl. So was Zach. Yeah. Google Caitlin. And hell. But
we'll try to make that happen.
yeah, we'll try to see if it's covered by your insurance. But I'm really passionate. When I came, my first year I was very demoralized because my first year I practiced was in '87. I went to dental school in Kansas City and they had water fluoridation, and we almost couldn't get our pulpotomy. You almost didn't graduate from UMKC every year because you couldn't find a kid with the need of pulpotomy. You needed 2 of them and a chrome stone crown. And then I came out here and I was in Phoenix and I was doing pulpotomies and chrome stone crowns all the time. And it took me, so I called the dean of your dental school, Jack Dellenberg, and so we started this Arizona Citizens for Better Dental Health. And I spent every Friday for a year because I said, well, sitting here drilling, filling, and billing from 25 to 75 and dropping dead is such a waste of time when you're not even doing the obvious. So we did every Friday for 2 years and got that done. And then I felt that I had done more dentistry than I'd ever do drilling, filling. I almost felt like I was done. I did my job. I came here and I made the community better. I prevented, the Centers for Disease Control sent me and Jack Dillenberg a letter, said that their models showed that we prevented about 850,000 cavities a year.
Wow.
And so, and God dang, that shows you how many people are crazy. 1 in 4 Americans think it's communist blood, causes thyroid.
Right.
Oh, it's just crazy shit. But my big issue now is access to care.
That's right.
And we have, and the dental students, 2/3 of them go to the city where only half of America lives, and only 1/3 goes to the rural where the other half live. And now you have states like Iowa, where they give you a list of cities, and if you go to any of those cities that they list that doesn't have a dentist, the state will give you $100,000. Delta Dental will give you $100,000, and then when you go to that city, the mayor says, "Well, we got 8 empty buildings. Point to one."
Pick one.
And you point to that. So now you got a free building, free land, $200K, and you don't have to take PPOs or fees because you're the only act in town. And what I see also in your deal is, man, if everyone else is closed and you're open, that's God dang, so access to care is huge.
Well, it just changes the game because all of us out there. It's not like there's 20 different ways to market a dental practice. Everyone's doing the same stuff. It's all about AdWords, or it's all about do I put an ad in the magazine, or
Sleep
is it a
apnea.
yellow page ad, or sleep apnea, or short term. I mean, everyone's trying to do the same thing, and so that's why you see all those signs for exam, X-rays, and cleaning. It used to be $79, then it was $69. Now it's like $29 a month, or $29 for that first visit, or it's free. Everybody's just trying to compete, and corporate is not helping with that either, corporate dentistry, and so it just drives. We're all just working harder for that 62% that already have a dentist, and so that's why we're passionate about it too. Just because we feel, I come from the cosmetic world of getting to change lives and seeing what that does, and I can take these clothes off, put on my scrubs, and go to an on-call location and feel that exact same feeling, but for a different reason. Feel like I'm there truly helping someone that's in pain, and it's wild to think that you can feel the same type of satisfaction.
It's like we've revitalized our practices and our feelings about dentistry. The passion's coming back. One of the things that we teach at our seminars is how to unlock hidden profit centers in your office. For example, in my office as an endodontist for the last 10 years, it's the craziest thing. And INDs and pulpotomies, just like you're talking about pulpotomies, that you know how to do a great pulpotomy, I don't see those anymore coming in my office. So a person comes into me with a crown and they've had a toothache for 2 or 3 days, and the dentist sends them over. Nobody's doing pulpotomies anymore. That's a hidden profit center that you can do in your own office. It's really not that hard to do. INDs, there's a specific art to do an IND, but we all get kind of nervous about how to handle that. Do I make an incision here or do that IND? But in our seminars, we're teaching dentists that there's things that we can do, going back to the roots of dentistry of how to do this simple procedure and actually get paid for it.
And I think one of the biggest hidden profit centers is, they only have one hygienist. My question is to you, how much water is in this bottled water? How much water is in there?
8 ounces.
So
16.
if you only have one hygiene room from age 25 to 65, you only have one hygienist. They never ever, they have the 35% for the dentist, 28 for the staff, 10 for labs, 6 for supplies. But they never have the room for an extra op. And they say, well, I don't know if it'll be busy. So it's fear. Yeah. So they're stuck on fear. So their capacity limits their hygiene. And then their emergency room, they call the front desk. Well, I have an emergency. Well, at a hospital, you don't need to call. No. You just walk down. I've told my patients for 29 years, this is today's dental. If you're having an emergency, you don't have to call the lady up front. That's right. Just come on down. Come on down. This is today's dental. And it's been the best idea. But the dentists won't put in an emergency room. And then they'll say, I don't have room for an emergency room, and their private office is the size of an emergency room. Yeah. And their break room is, or they just won't commit to, well, then maybe you should move and buy a bigger location. But I think the 2 biggest profit centers is add a hygiene room, not because hygiene's profitable, but checking 2 hygienists every hour. You're going to find a lot more fillings and crowns than checking 1.
Absolutely.
And you have to have an emergency room, and they say, well, I don't, the schedule, there's no room. Well, you're going to have no-shows and cancellations. And here's another thing I noticed. I had 4 boys. You have 4 boys. You have 5 boys, 5 kids.
Yeah.
You work through lunch. When you have 5 kids, you work through lunch.
No, I haven't taken lunch in years.
Yeah. When I had 4 boys in 60 months, I worked 7 to 7 Monday through Saturday for just a decade or 2. Yeah. Just a decade or 2.
Just to stay.
And so it's the boys. It's the boys whose dad paid for dental school, didn't get married, don't have any kids. And at 5 o'clock, they want to hit the clubs and have a martini and chase girls. Yeah, they're not the people you're focused on.
Right.
You need to go out there and get a list of all the dentists who have at least 4 children.
That's right.
And because when you have 4 kids, you're hungry. Yeah. And when you're hungry, you're going to work through lunch and you're going to stay late. But add a hygiene room and add an emergency room.
Yep.
And quit living in fear. Just do it. I want to ask you. I want to ask you, a father or something. How old are your children? The same as mine?
Yeah, mine's oldest son is 27. I got 5 boys.
So how old are you then?
I'm 50.
God dang, you look 10 years younger than me, man. I must have had some hard years there. I want some father-son advice. So many of the graduates walk out of school. And, I lectured at a lot of these schools. They're on Dental Town. And they say, I'm $350,000 student loans. And you start talking about what they're doing. And they just walk out of school and say, I hate endo. I ain't doing it. It's a wall. What would you say to a little girl who's 25? She's got $350,000 student loans, and she's already decided she hates endo. She ain't going to do endo. She hates it.
So the first thing I tell, and this is the advice I would give.
See, I even said endo, and the 2 cats started fighting.
That was so funny.
The first advice I take a little step further, and because I deal with a lot of these types of scenarios with these kids coming and saying, what would you do? What's your first piece of advice? My first piece of advice is live like you're a student for 2 years after you graduate. Number 1.
And personal cost.
Personal cost. Because you know what? By doing that, you're going to just set yourself. Don't go out and buy the car. Don't go out and treat yourself, so to speak. But then the second piece of advice, if I'm thinking about endo, it's learn how to do simple anterior bicuspid so that it's predictable. Get great skills. Go take a course that will actually teach you that the number 1 skill that I think that we're missing right now as young graduates is diagnosis. If you have strong diagnostic skills, the endo is secondary. And it's funny because one of my instructors in school says you can teach a monkey to do a root canal. So really, it starts with the confidence of really solid diagnostic skills. And then the endo is easy. You can learn to do an anterior and a bicuspid, and then it progresses from there.
Here's another thing that I did differently than they do. When they were to learn something, they always go to the airport, fly across the country, stay in a hotel, and drop $1,000 for a course. I had 4 kids. I got it at $87,000 student loans. My dad said my dad wouldn't pay a dime for my college because he said if he paid for my college, I'd just go up there and smoke pot and chase women.
No skin in the game.
Yeah. So I graduated $87,000 student loans. When I needed to learn endo, I drove across the street to the endodontist and said, "Can I watch you? I have nothing on. I have a 2-hour break. Can I watch you?" And they would say, "Yeah."
Absolutely.
They say he doesn't want me to do that because if I'm across the street from you, and why would you teach me to take away from feeding your family? So is it thinking fear and scarcity? You're not going to help me because you want me to stay in the dark and have poor endo skills, so I give it all to you. So I'm going to fly across and go learn it at a course in California for $1,000 because he's going to make $1,000 from me teaching me endo. Why would you do it for free and hurt your own business?
Well, I think the first thing is that and if I look at you and I've watched your career, you've been like an awesome mentor. It's the same thing, the reason you talked about at the beginning of this podcast about Dr. Joe Harris and his mentoring you. So number one, as specialists, really we do have that in us, and as specialists in dentistry of today's dental, we want a mentor. So that approachability, it's actually there. I have dentists that come in my office all the time and come and learn, and maybe I'm not going to teach them exactly how to do the perfect endo, but I'm going to give them a tip that's going to make them better. But what's going to really happen is they're going to get really good at doing the anteriors, the stuff that they really feel comfortable with. But really what's going to happen is they're going to see in my environment what I'm doing well and how I treat patients. It's going to up their game. Then they're going to view me more importantly as the specialist in the area, and I'm going to get more referrals. So really we need to change our thinking about that mentorship, and especially the young 25-year-old female, or even the young male that's coming out. Hey, we want a mentor. We want to help. We're not trying to keep you from doing it.
Plus, what I loved about it is if this oral surgeon across the street was showing me how to pull a wisdom tooth, and then I tried it and only got the crown out,
yeah,
and had to send the roots, I'm sending it to my buddy. I know this guy. I know him in the flesh.
That's right.
I don't want to send some broken file in a second molar to some stranger I couldn't pick out of a police lineup. I'd rather it be like, I know Steve, have mercy on me. You know what I mean?
Yeah. Well, I've been in his office, and I know what he does, and I know he's going to have my back, and you know what? He's actually going to treat the patient with respect, and then I'm not going to look like I'm the idiot that did something wrong.
Yeah, and I can't. My endodontist used to tell me, you owe me 3 incisors for that, okay? And I'd say, cool. You get the next 3 incisors for that screw up. I want to ask you another question that young kids have a problem with. It's a failed root canal, and they are getting mixed messages. Some have seen the insurance data saying apicoectomies and retrofills are plummeting, and sometimes they're just sitting there and like, should I retreat this root canal or should I extract this thing and put titanium? What are some guidelines when you're staring at a fork in the road and you're not sure which way to go?
I tell them exactly the same thing that I would want done in my mouth. You know what? Because I trust that those procedures, the retreatment, the apico. Look, if we prolong that tooth 10, 15 years, 5 years, you know what? That's way better than having, to me, in my opinion, in my mouth. I want them to understand that, what I want done in my mouth is what's going to be, easy. So let's say that you have a retreatment in your mouth and a tooth, maybe it's a missed canal, maybe it's just, the crown had leakage and you needed retreatment. What are you going to do? You're going to go straight to an implant? No way. As a dentist, I'm not going to. I want to get that retreatment first and clean it up and so.
Well, you already succinctly nailed it. It's always the same. You just look in the mirror. What would you want done for yourself?
For me.
Just what would you want done for your 4 kids? It's just
take the money issue out of the implant.
Yeah, take the money out. Yeah. A couple more questions they asked. Is it standard of care to do molar endo to have a CBCT since the number 1 cause of root canal failure is missed canal?
I think it's headed that direction. I really do. I think we practiced for many years without it. But I think that, I think that just for us to be able to stay within our scope and realize and have a CBCT and say, here we go. It does have a 4th root and it's difficult, or it branches at mid-root. I think information is going to be key. So I think moving down the road, I think it's definitely going to be standard of care.
Same question with the microscope. We have a global out of St. Louis. We have what's the one out of Germany?
Zeiss.
Zeiss.
Yeah.
Can you really do the best endo without a scope?
You can't treat what you can't see. Well, if you can see it, you can treat it. So I hope that answers your question.
So what you're saying is Stevie Wonder could not be an endodontist?
Yeah, he could
Are you
not
saying
be an
that?
endodontist.
He could not
That's
be an
exactly
endodontist? Yeah. And then, of course, I don't want to get you in trouble or throw you under a bridge or anything.
Yeah.
Some people don't like these solid carrier gutta percha obturations. Some people say because if the endodontist can't get it out. Is that true or false?
I think it's false.
You can get it all out.
I mean, it's more difficult. It makes our life miserable. Let's be honest. It's to get those carriers out. Sometimes takes us an extra half hour, 45 minutes, or an hour to
Really?
get them out. But you know what? I don't think it really matters. I think that, and I may be kind of stirring up a hornet's nest here. I think the most important thing in endo is the prep. It's the irrigation and it's the prep.
What do you mean the prep? The preparation of the canals?
Absolute instrumentation. I think that what we fill it with is, not quite
Alterations.
as quite
Endo's about what you take out, not what you put in.
100%.
Yeah.
So I think we all get caught up in the carrier, but I think the carrier issue is that it creates more work for us.
Now I'm going to ask you a very politically incorrect question that no one likes to talk about, and it's a plague. In great civilizations of Japan, France, UK, the wise government reimburses a molar root canal at $100. No one will tell you this on a podcast, but when you're having dinner with them, they tell you that they have to place a post in each canal because they get reimbursed for that. And if they don't put a post in every molar canal, they can't even break even on the root canal. So due to reimbursement, they're only getting $100 US for a molar in London, Paris, and Tokyo. Three of the greatest those three cities are beat the hell out of Phoenix, and they're getting $100. So they have to put in a post. So my question is, a lot of Americans say the only function of a post is to fracture the tooth. I want to know, is that true or false? And number two, if you were going to post a tooth that didn't need it, but humans can rationalize anything for reimbursement. If you got to stick something in the canal, and all three canals, because you got to break even on a root canal because you want to do it like they do in Phoenix and New York. I just threw 50 questions at you. I don't even know.
Good luck with that.
Good luck with that.
So
any of them questions good enough to comment on?
The quandary is there. There's no question. So I'm a real passive guy. I believe that if you're going to put a post in, it's got to be the smallest post possible. And I'm a big believer in the fiber posts and not over preparing the post space. So one of the things that's the big focus in endodontics right now is minimally invasive treatment. And so, you know what? If we have to put a post in, I'm a big believer in a parallel type post, passive, nothing that's screwed or nothing that's over prepared. Keep the post.
Any brand names?
No, I don't have any that I think.
So you cement so the main thing is don't go through those gauges and bore out a big hole and put in a big post.
No,
so that's the main thing. If you got to put a post there, you shouldn't be boring out the hole bigger. So put in something small, and you like fiberglass.
I like the fibers.
Okay, can you name any brands?
I use the Kerr fiber post. Do you remember the name of the
Kerr fiber post?
I don't know.
So, but it's fiberglass.
It's a parallel post, and it's fiberglass, and it's the resin.
And what would you
type
what would you cement it with?
I use
whatever's in the kit.
Yep, just a little resin cement, and I'll prepare the post space. I think one of the keys in that whole process is making sure that post space is dry. Sometimes our cements don't cure very well, but when we're putting cement down there and we're putting the fiber posts in, we're able to get a great monolithic cure down inside that space. So.
When you go to different countries, very common in Asia, where dentists will tell you that what's wrong with American endo is they only use bleach. And they have almost like a religion. First they do hydrogen peroxide to oxidize the gram negatives. Then they do chlorhexidine gluconate. Then they do bleach. It's like a ritual. It's like a 4-course meal. Thoughts?
You know what? I just stick to what works with, and what the best people in this country are doing, and that's the Steve Buchanans, the John Wests, and Cliff Ruddles, and they're all talking about irrigation with full strength bleach and alternating with EDTA, and that's it. You know, and to me, my thought is, you know, keep it very simple. The quicker I can get bleach into that canal, the faster I'm going to get it sterilized. I did a little experiment a few years ago where a 14-year-old kid pulled out a palatal nerve out of a tooth, and you know, sometimes you'll get them when they're stuck, the nerve stuck to the end of the file, and I took that and I cut it in half. And I put that little piece of nerve into a cup of bleach, full strength, 5.25%, Clorox fresh scent bleach. About 12 minutes, that nerve is completely dissolved. Okay. Then did the same thing in a heated bleach, and I think Cliff Ruddles, you know, give him props. He's fantastic. He talks about heated bleach, you know, maybe 120 degrees, maybe a little bit more. That other half of the nerve, I put it into a cup of heated bleach. That thing was gone 2 minutes faster than it was in a regular bleach. So I'm a real big proponent of doing what's being done here and what the big guys are doing, and they're all talking about a bleach slash EDTA type.
There's also some technologies where I noticed there's some little brushes that come out. Some people stick an ultrasonic cleaner in the
That is absolutely the hottest thing right now. Is anything that you can do to sonic activation down with the irrigation down in the canal to remove smear layer, to remove debris. That is absolutely the hottest thing right now. Irrigation is the hottest thing. So to me, if I'm somebody that's listening to your podcast and I'm saying, okay, what's the one takeaway that I can, you know, make my endo even better is, you know what? To me, the faster, and without compromising quality, the faster I can get that tissue out of the root and introduce bleach into the canal, the better success rates I'm going to have.
And would you say the number one cause of endo failure is a missed canal, or would you say it was an improper final restoration or a delayed?
I would probably say that's a combination. I think, you know, one of the things that we looked at in different studies throughout, you know, the years, you know, if you look at dental school root canals that take 4, 5, 6 visits, where they're using bleach for 2-3 hours a visit, you know, and they're using the chemicals to debride down in there. I think those are the ones that are the most successful. So, yeah, I think that you know, it's the craziest thing when you look at the worst endo in the world, but it has the most perfect restoration on top of it. Those are successful. When you have the best looking endos in the world, but the worst restoration on top of it, the coronal restoration, those fail. So I think it's definitely a combination of fantastic restorative means everything.
Final question, because I know you guys are busy, got to go, and I only got you for a minute and a half later. A lot of endodontists are on Dental Town are struggling with the decision, should they learn how to place implants or not? What is your thoughts on that?
You know what? I think that's a great point, and I know that a lot of endodontists are actually placing implants, and they're headed that direction. We're dealing with roots, and replacing roots with an implant is right up our wheelhouse. My opinion, you know what? If I'm busy as an endodontist doing root canals, and I'm going to stick to what I do really best, and I'm going to stay in that direction. But I think that definitely, I think the direction that Steve Buchanan's and the other people in the world is, hey, look, this is in our wheelhouse. We need to be placing implants and assisting the dentist. We're there if we flap a tooth for an apical surgery and if we find that it's fractured, man, why aren't we doing the bone graft and getting ready for the implant? Because we're there. We know the tooth. We know the root patterns and the structures and where to go from there. So,
Do you think in 10 years from now you'll be placing them, or probably not?
Oh, no question.
Oh, you will in 10 years?
I'm sure I will.
Yeah.
Yeah.
I thought that was a very. I always think I always go back to the remote control, and the remote control is the most god awful assortment of buttons, and I've never been in any home where people don't have issues. And the reason is because when they go to design it, every team from DVDs, VCR, cable, everybody's trying to get all their stuff in. And then you go to the great companies like Apple and Google, and they say, no, the CEOs, I'm the customer. And this is confusing me, and I don't care about your department and your buttons and that button. So Google, you know, every time they get to a fork in the road, Sergey always says, well, what does the customer want? And when I look at access to care, available to care, consumers have been bitching to me about having to go to 20 different places. If I went to the doctor, I don't want to, you know, and that's what they tell you. Well, you need to go see this guy. You need to go to an endocrinologist. You need to go. I'd rather just walk in one flipping place and have it all done.
No question.
And I think humans will be a lot healthier if it's faster, easier.
You're right.
And we need to take a lot of the visits out of healthcare. It'll drive down cost, and it'll improve care because they're more likely to get done. Because when you tell Grandpa, you got to go to 4 different people to check your endocrinologist and your cardiologist and all. What's the chance he's going to go to all those appointments?
You're right.
Yeah, very low.
Very low.
Yeah, but if the doctor would just deal with all that stuff or make a facility or... All right, well, it is a huge honor that you would spend an hour with me and my homies. If you guys want to come over and pitch that to my team, tomorrow is our monthly meeting. If that doesn't work for you, we can find another time or do it next month. But we're meeting at Dentaltown 1 to 2. I'm so interested in hearing more about this. And tell your father that he's still my idol and role model and that he has 4 amazing kids. And I hope
Thanks,
I hope my 4 boys. I think my 4 boys turned out as amazing as his 4 boys. And good luck with that daughter. I hope she's a lot of trouble.
She's awesome.
I hope she's a lot of trouble.
She's
since you
the
got
princess.
her and I didn't.
Sorry. Sorry to break it to you. She's the princess.
And thanks for saving a life,
Thank
buddy.
you. Appreciate it. Thank you
All
very
right.
much.
Thank you so much.
Thanks, Harry.